Hi, everyone. Dr. Elizabeth Bonet here. Dr. Liz, welcome to the Hypnotize Me podcast. Before we jump in, please note that the podcast is not mental health treatment, nor should it replace mental health treatment. If you need psychotherapy or hypnotherapy, please seek treatment from a trained professional. I do hypnosis all over the world, so please feel free to contact me through my website, drlizhypnosis.com, DRLIZ hypnosis.com. Hi, everyone. This is Dr. Liz. Welcome to the Hypnotize Me podcast. So happy you're here. I have a great interview for you with Reverend Dr. Anthousa Helena, and she talks all about medical intuition. I think this is pretty timely with the coronavirus going on and people worried about their health all the time. I mean, even someone coughing once or twice, you're like, oh, am I sick? Or is that just a cough? Because we cough as human beings all the time to clear our throats or whatever. So this may give you a good sense about how to get better in touch with your body and listening to it and what it needs, as well as when to seek help. Now, before we jump into the interview, I do want to let you know that I am launching an online group to help you sleep better. It's called Sleep Better, Feel Better. And so if you struggle with your sleep, that's starting May 5th, 2020. And you can see more about it over at my website. You can go to drlizhypnosis.com/sleepbetter and find out all about that program and how to join. I know that's another thing people are struggling with right now is sleep. And I have planned to launch this way before any pandemic hit, but it is really useful for you to feel like you're more in control of your sleep and to wake up happier, not worrying about it so much, like wake up feeling refreshed, rested, ready to face the day. That's the whole goal of the program, to help you feel better. All right. Hope you enjoyed today's interview, and I hope that you and your loved ones are safe and healthy. Peace. Hi, Anthousa. Welcome to the Hypnotize Me podcast.
Thank you. Good morning to you, Elizabeth, and to everybody else that's listening today in the audience.
So let's jump right into questions. How did you originally become a medical intuitive?
Oh my. Okay. Now I have to go back to when did I do that? It was so long ago. Just with our professional licensing, we always have to have continuing education credits to, keep our certifications and so I was always looking for things that interest me and go along with what I already do, the other modalities I already do. And then the flip side of that is, that adage, I'm not sure if I'm saying it correctly, when the student's ready, the teacher will come, and somehow the universe just brings it to you.
Mm-hmm.
And I believe I was working or being with a friend that's a friend and also colleague and a client. She had mentioned that this medical intuitive from Russia, a doctor, who's actually well known, and he's researched and studied here by University of Arizona. I guess they do a lot of research studies. So he was here in Florida and he was doing this training, and she mentioned it, and I thought, well, okay, let's try that out, because I was already doing a lot of different modalities that deal with energy.
Okay. Such as what? What were you doing already?
Oh, well, gosh, I've been in business for like 45 years. So already was doing cranial sacral therapy, which is a physical osteopathic technique. But it also has an energy component and a component to it that you can do remote distance healings by viewing the person. It's part of the more advanced trainings. So I was already doing that, and I thought, well, whatever medical intuitive stuff must be like, a jump up or a grade up from, viewing the way that I had been trained.
Mm-hmm.
But also in craniosacral therapy, which a lot of people in South Florida do know me for, is that the basic theory that Dr. Andrew Still, back in the 1800s, he was a cranial osteopathist. And he was the first to study or founded craniosacral therapy. And his theory was the body has inner wisdom to heal itself.
Mm.
And then later on, other physicians studied more. And then I worked for Dr. Upledger, who's also world renowned. And he wrote a book, Dr. Upledger, called The Inner Physician in You.
Okay.
So I was always like, okay, we have inner wisdom in our body that each of us individually, when we can tune into that as
Mm-hmm.
best as we can and trust it. I think that's the big issue for a lot of people. They'll get an understanding, oh, something doesn't feel right in my body, I wonder what it is, and they're right on with whatever it is,
Uh-huh.
but maybe they don't trust what they're getting.
Mm.
So the therapist helps facilitate their investigation of that. And so then I thought, well, that medical intuitive thing must fall into this same area.
Mm-hmm.
It does, and it is heightened because it's all about just remote distance healing and energy work, and you don't even have to look at the person's body or be with them in person. And so I did like 2-year training with this doctor as like I said, he's from Russia,
Mm-hmm. That's a
medical
long time. 2 years.
most trainings do take a long time if you're going to, really
That's
keep
true.
doing all the levels and the advanced levels, and also become, the best that you can be
Absolutely.
in the
Yes.
things that you're offering people. And he was nearby. So I was like, well, I'll take advantage of it. So the last year of the training was actually an internship.
Oh, hold on just a minute. That's my dog. Okay, so the dog's calmed down. My friend came in.
I know, I freaked out. Oh no.
Sorry.
Oh, well.
All right. So you were saying that he was in Florida?
Oh, yes. And
Okay.
the center's now closed, and I'm not sure where he's at, but like I said, it was very opportune for me at the moment. And so the last year of the training, if you wanted to do it, was actually an internship that you went into his office on a daily basis and worked with him with his patients. And he
Wow.
observed you and gave you things to do after he was done, in quotes, diagnosing
Mm-hmm.
the doctor. And so that was really the cherry on top of the sundae, or because
Yeah.
that's really where I got the experience of the 2 years of training. Now, we didn't meet every day. It was like
Mm-hmm.
a week every 3 months. So it was like maybe 4 times a year to do the 2-year training.
Okay.
So the thing there too is I had been a yoga teacher for 28 years.
Mm.
Yoga talks a lot about energy components in our body. And I also had been doing acupressure
Mm-hmm.
and medical qigong, which also deals with our energy systems. But studying the medical intuitive format was even more in depth and gave me more wide or broader information of scope that added on to all these other levels that I had been doing and studying. So it was
Yeah.
really good, and I also feel like it allowed me to get in touch with my own body
Mm.
even more.
Mm-hmm.
And I think that's so important for people to really feel what's going on within themselves. Like, one of the things with cranial work is pain is a signal.
Yes.
So, when you get pain, it's not something to get all, worried and upset about, at least at first.
Mm-hmm.
It's something that's like tapping on your shoulder, or a stop sign that's saying, stop for a moment,
Mm-hmm.
Listen to me. I'm trying to tell you something. I'm trying to show you something.
Mm-hmm.
So, upping the ante by doing the medical intuitive stuff, not stuff, I'm sorry, training with the other formats that I had already been doing
Mm-hmm.
in my life really allowed me to feel like I was in touch with my own body and my own self even deeper.
Wonderful.
Yeah.
Wonderful.
And I think
So,
I try to do that with clients when I talk to them or work with them. I'll say, "Do you feel what's going on right now? Do you have a sense?" And I get them into conversation, and I say, "Well, what are you feeling? Because what I'm feeling may not be the same as what you're feeling. And when we work cooperatively together,
mhm.
we're on a journey together, and we're supporting each other to do the highest and best that we can for that client."
Absolutely. Yeah, I see how that could be a really good fit. I have a yoga background too, taught for 18 years or so. And also bring that body awareness into my work as a therapist. Like, where are you feeling that? Where is it coming from? Where in your body? But I could see how that's an easy step over to if you're having some kind of medical problem or physical problem. All right. So, what does your body tell you about it? Where is it? I mean, really, that's the first question even a medical Western trained doctor will ask you, right? Where are you
Yes.
hurting?
Yeah.
Right? Like,
Yeah.
where's the pain? Right?
Yeah.
Or if you go to the ER or something, what's the problem? Right? Where are you hurting? And so,
Right. Right. What are
uh,
you here for? Yeah.
yeah, exactly. So, people do have a sense of that. But how do you recommend, like, is there a simple exercise where someone could get more in touch with what's going on in their body?
Oh, well, yeah, that's a good one. Um, I really have been a meditator for quite a long time and,
Mhm.
started that when I was first introduced to yoga. And there are many different forms of meditation.
Yes.
But I say that that would be a good daily practice to
Mhm.
help you at first get in touch. And there's so many forms of meditation that sometimes people want to shy away from that.
Mhm.
Even just sitting and contemplating is a form of meditation, giving yourself time to, if you have a nice backyard or you're at the ocean or in the mountains
Mhm.
or, just in nature somewhere and you can just sit. And if you don't have any of that, just a quiet, special place in your home somewhere
Mhm. Yeah.
that you can just be in total silence
Yes.
and you could use your breath to
Mhm.
help you or simple things you can just look at I remember one of my first ones was just gazing at a candle flame. That
Uh-huh.
was a
Yep, I know
long
that
time
one.
ago. Yeah.
Yes.
and
Yeah.
and then just allow the mind to just release any of its constant chatter,
Mhm.
and then there'll come a point where you just feel really still. And when you're in that stillness place, which is a neutral mind,
Mhm.
that's when things can kind of come bubble up within your awareness. And
Mm.
it can come through, oh, gee, my shoulder's hurting or my knee hurts. Oh, I
Uh-huh.
wonder what that's about, and you don't have to investigate too much. You just allow your attention to go there.
Uh-huh.
One of the things in cranial sacral therapy and more of the advanced work that we do is we actually communicate with the area of the body that's hurting. So I'll ask the patient, well, if you have a knee pain, so let's
Uh-huh.
get into a neutral state, let's calm down the nervous system, and together we're going to explore. So just get in touch with your knee and, ask your knee what it's trying to tell you, and then we allow things to just bubble up and we dialogue together. It's actually how
Interesting.
I got into psychotherapy and becoming a psychotherapist because I was a massage therapist first and doing
Mhm.
craniosacral therapy. And Dr. Upledger actually suggested
Uh-huh.
that I extend my education into psychotherapy because there is so much what they call somato emotional release, which
Yes.
has to do with let's dialogue, let's talk, let's
Yeah, so I was just gonna
combine
say, like, often when I do hypnosis,
yes.
and if I'm doing a longer session, which is typically a deeper form of hypnosis, I will say to the client, if a body part keeps aching, it's a long session. Maybe you just need to move around. But if that doesn't help, maybe it needs to talk to us. So let me
Yes.
know and we'll talk to that body part. And I had my own experience when I was doing core healing where I think it was my left arm that kept aching. And sure enough, it had something to say. Absolutely.
Yeah.
So, yeah. So I love that. Yeah. Just getting in touch with it. There was a book I read, this must have been, I don't know, 15 years ago, but she talked about always speaking gently to your body parts.
Yes.
At the time, that was a really new concept to me. I was frustrated with my body. It was after I'd had my first daughter. And so many times we tell our body like mean things, like we speak to it very meanly, like, oh,
Yes.
you know, my darn knee or whatever, and something like
Yeah.
that. And it was a
And
shift for me to say, oh, perhaps I should talk to it kindly.
yes, I always do that. I say, I get the client or even myself in a more neutral meditative state and remember to be kind and polite. Your knee is causing you pain, just go to it gently, introduce yourself, say hello, like, you're just meeting a new person for the first time, or you're seeing a new little child that, has so much light and you haven't spoken to them for a long time, or
Mhm.
and you just are gently being polite and curious. It's interesting that a lot of times that once you start dialoguing with whatever the pain is and it gives you the information that it's been wanting to give you, that
Mhm.
pain actually will go away. Now it's not always the case, but it does.
I've definitely had that as well in my life where once it feels resolved, or I've seen it in clients too, like I had a case that was fibromyalgia. Well, that is very physical, right?
Yes.
It is lots of pain all over
Yes,
the
it is.
body. And with hypnosis and some dialogue and some going back to resolve some beliefs, her fibromyalgia went away.
Yes.
That
Yeah.
it felt like a miracle to her and to me.
Well,
I'm
it
like,
is.
I'm like, yeah. But it was through that real process of releasing the pain, releasing the need in the
Communicating.
body. Yes,
Yeah,
communicating.
communicating. And
Absolutely.
and yes, that if so many more people knew, I mean, it sounds simple and it sort of is, but it is such a key tool, and it can be so simple to prevent anything from getting worse or further progressing into
Yes.
something that you really don't really want it to progress that far. But
Yeah. So when you work with someone, is it with the intention of just discovering what's going on or trying to resolve it without, let's say, Western medicine? Or is it really like exploring, okay, what do you need here? What's the intention there?
yes, well, everybody comes to the plate with different ideas or different situations, or so I always ask them to really think about before we actually have a session together. What is their main focus and what is their main intention? Spend some
Mhm.
time to do that so we can progress from there. My main focus is always to assist them for their highest and best interest, of course, but to find out the underlying truth of what's really going on. And sometimes it's just a disconnect
Mhm.
from some part of their being.
Oh.
I do integrative medicine, meaning that I look at the physical, mental, emotional, energetic, and spiritual aspects.
Mhm.
So I do often find that one of those areas they're disconnected from. And
Mm.
sometimes it is, the spiritual aspect for whatever reason. Maybe they just had a heartbreak or a
Mm.
trauma in childhood and they didn't realize that, you
Mhm.
know, something happened there that disassociated. or they created belief systems, like you said, that just needed to be reframed or
Mm-hmm.
rewired or come into more of a positive understanding. The other thing too is, the message that the inner physician is going to tell the person, whether it comes from the physical doorway or the mental doorway or emotional doorway or spiritual doorway, because we're all doing the same thing, we're just coming in from different entrances.
Mm-hmm.
That's what
I
I
love
feel.
that. Yeah, I love
Yeah, that's
that.
my
Yes.
opinion, like,
Yeah.
you go to a massage therapist or you go to a psychotherapist or you go to an acupuncturist or a
Uh-huh.
hypnosis
Yeah.
person or a medical doctor. We're all trying to serve. We're just coming in with our different gifts and talents,
Mm-hmm.
entering through a different doorway, but we are all one whole being. So whatever doorway we enter, we're going to get to the core of whatever's happening. If
Yeah.
the person has to be really willing to go there. So that's
Yes.
the
Yeah.
other
Yeah.
thing.
So some people are more comfortable with one doorway than another.
And that's why they seek out different types of modalities.
Yes.
They're more
Yeah.
comfortable. I'll just go to hypnotherapy or
Mm-hmm.
psychotherapy, or I just want to have body work. So or,
Yes.
acupuncture, they really love the traditional Chinese medicine too. But once they get the message, this is the important part that I was getting to, is they still have a choice then. If the
Mm.
body or mind or spirit is telling them, maybe you need to leave your husband or wife, or maybe you need
Mm-hmm.
a new job, maybe you just need a vacation, maybe you need to change your diet, maybe
Mm-hmm.
something in a habit in your lifestyle you've been doing for a while, possibly is not the most beneficial thing for you to do to deal with stress or life. So, you'll get the information from your inner wisdom, but then the client or person, myself as well, still has another step to take.
Uh-huh.
They have the choice on whether they're going to listen or not and actually do that.
Absolutely.
And that's where sometimes the healing, or let's say getting healthier,
Mm-hmm.
will work or not work. You
Yeah.
know what I mean? Because if they choose, well, I don't really want to give up my business. My business, gives me a lot of,
Yeah.
financial pleasure, even though maybe I just want to go do something else for my life that maybe is not going to make me, as much money.
Uh-huh.
That can be an inner conflict with a person.
Absolutely. Yeah.
That's that other big step. And you have to really, really then assist them, if they want assistance, to work through that. What are the underlying fears or belief systems or things?
Absolutely. Yes.
Yeah.
I had a friend who used to work for a big corporation, a big retailer in the US. And after about 6 months, she went on high blood pressure medication. And one of her coworkers said, "Oh, yeah, that's what we do here." Right? Like, yeah, like everybody is on high blood pressure medication because the job is so demanding and
Stressful.
stressful. Yes. And so that's an example of, all right, yeah, you can stay on the high blood pressure medication or you can look for another job. And I see that in all kinds of areas too. I
Yes.
often see that in marriages, or even for myself, an episode I aired just a couple of episodes ago. I can't remember the number, 148 maybe, where I tell about my weight loss story. I would read this stuff about my thyroid, get overwhelmed, stop. For me, what changed is a deeper hypnosis technique where I really begin to value myself and said, okay, I'm worth taking care of. I'm worth figuring this out. I'm worth, like, let's go step by step and not get overwhelmed here, you know?
Yes.
That all kinds of changes could be made that I really needed to make for my health.
Hmm.
So that's a personal example there. But that is really interesting. I absolutely loved how you talk about that and how you see it. And I can just picture opening a doorway and some people peek through and get the answer, and some people jump through, right?
Yes, yes.
Or maybe fly through. Who knows? They appear all kinds of ways, teleport, right?
Yeah, or decide to close the door and I don't want to look. So, that happens
Yes.
too. Yeah.
Right, that too. Yeah, so thank you for sharing that. Well,
Mhm.
we are almost to the end of our time here. Can you tell people how to find you if they'd like to work with you?
Oh, thank you very much. Yes, my website is Soulite. That's SOLLITE.com. And there's a lot of good information there. I have also on a lot of social media, I have a YouTube channel that has a lot of free information and videos. I have blogs that's with my website and my Facebook business page. I weekly send out a inspirational message as well as do videos and talks there too.
Wonderful.
And so that's Anthousa Helena. YouTube channel and Facebook business is Soulite Anthousa Helena. Again, that's SOLLITE. I also have written or co-authored a book
Mm,
called While We Were Silent. There were 12 authors that came together that healed from sexual trauma.
mhm.
So my expertise has been known in assisting people with post-traumatic stress disorder in whichever way that it comes. So I do have an Amazon book page that actually has an interview video on it.
Fantastic. And you have some courses on your website as well, right?
Yes, yes. My website is about having private sessions like we're talking about
Mhm.
and all the different modalities that I offer. But I do specialty program trainings, which are shorter, that are a month long. One of them is a 2 month long, that is a self discovery introspection program. And then the longer 6 month training program in integrative medicine is the practitioner training program. And that explains all the modalities that I incorporate in the work that I do. So even if you're not interested in doing a 6 month practitioner training, looking at that portion of the website explains to you in depth the different modalities that I'm doing when I'm actually working with you in a private session.
Fantastic. Thank you so much.
Thank you so much.
Yes. And thanks for being on the podcast. I know lots of people will enjoy this interview.
Yes, well, I appreciate it. I appreciate you. And thank you all for listening and have a most wonderful, blessed, joyous day.
I hope you truly enjoyed today's episode. Remember that you can get free hypnosis downloads over at my website, drlizhypnosis.com, DRLIZ hypnosis.com. I work all over the world doing hypnosis. So if you're interested in working with me, please schedule a free consultation over at my website, and we'll see what your goals are and if I can be of service to you in helping you reach them. Finally, if you liked today's episode, please subscribe to the podcast or tell a friend. That way, more and more people learn about the power of hypnosis. All right, everyone, have a wonderful week. Peace.